So, yes, my practicum presentation is about my time with the Afro-Canadian Positive Network of BC, ACPNet for short. So if I use that, that's what it means. Um, in the presentation, I'll be going through the practicum, the overall summary of the practicum, my practice scenario, PHSP skills I use to address the practice scenario, my TRC call to action, PHSP values that guided me throughout my placement, insights I've gained through my practicum, and some final acknowledgements. So the Afro-Canadian Positive Network of BC is a grassroots organization located in Surrey, and their primary population is individuals of African descent who are living with or affected by HIV, and they address these populations through peer support, outreach, and advocacy. The role of my practicum was really multifaceted. I did a bunch of different things. I was fortunate enough to go in and tag team a grant application, conduct a literature review, but most importantly, what took up most of my time was the development of data collection tools for ACPNet to implement, hopefully sustainably. So the social determinants of health are a huge barrier to this population in accessing services with respect to their HIV. So when I was developing these data collection tools, it was very, very important that I took this into consideration in every step of the development process, because I felt as if I didn't do that, it would have not reflected the realities that this population experience on a daily basis, and therefore I wouldn't have been able to optimally help ACPNet in collecting the data they need to optimally refine and deliver their programming in the subsequent months and years. So the PHSP skills I use to address this in the development of data collection tools are interprofessional collaboration, written and oral communication, and cultural safety and competence. But for time, I'll just briefly touch on the interprofessional collaboration. So this was really the guiding principle in my whole practicum, and especially with regard to these data collection tools. For example, whether it was constantly gathering Zoom meetings, engaging with members of ACPNet, constantly bugging my supervisor, Dr. Lachowski, for input, and also going beyond the walls of ACPNet and reaching out to individuals who I have connections with that I know have carried out similar work in the past. So it was a really nice experience engaging with so many different parties, and I found it to be very rich and helpful. So my call to action that I've chosen is with respect to Aboriginal healing practices in the Canadian healthcare system. And I chose this call to action for two reasons. The first is that I have a very big passion for health and medicine, and I feel as though our current Western medical model, in very many instances, can not really value alternative modes of healing and thinking and perspective. And so I really value the healing practices and the worldviews that our Indigenous populations have brought to the table. And I feel as though they certainly need to be integrated into the healing model, especially with regard to Aboriginal patients. And secondly, I over the course of the program, I grew a sincere interest in working with these populations. And so I just figured it was an appropriate call to action to choose for that reason as well. And a couple of values that really guided me through my placement were interprofessional approaches to practice and critical analysis drawing on principles of social justice and equity. Specifically, however, critical analysis drawing on principles of social justice and equity because, this population faces many barriers and a lot of stigma and discrimination with respect to primary healthcare settings. So drawing from these principles really helped me to engage and work with these populations, and the work I was required to do with ACPNet in an effective manner that I felt allowed me to contribute a bit more meaningfully and effectively. And yeah, this is a loaded question. There's a ton of stuff I learned from this practicum. I couldn't go. I'd be taking up the whole course of the conference talking about it. But specifically, I feel as though I gained a pretty good understanding as to what it means to be a white male working with these populations who have a completely different cultural background and a completely different lived experience from me. You know, it was incredibly humbling, and it also really shed light for me on the necessity to possess a perspective and a drive for a lifelong learning. Yeah, just an urge for lifelong learning in this field. It really became apparent to me for this, and so that's something I'm hoping I will take and keep with me for many years to come. And yeah, just a final thank you. I want to thank Natalie and Betty for all your support this semester, and Natalie for your support over the course of the whole program. All the PHSP faculty and staff who I've been involved with over the last couple of years, and especially Dr. Lachowski. If I think he's here. I think I saw him. I think he's still here.
Hi, Adam.
Yeah. Hi, Nate. Yeah. If he wasn't around, I was lost at several points throughout the course of this practicum, and he made it just an overall really rich experience. And yeah, I'm really grateful for that. So thank you all.